Joint types. All right, so our joints or articulations in the skeletal system range from very stable to very mobile. So let's start with the most stable or the synarthroidal joints. One is our sutures, and we have a lot of sutures in our skull that kind of keeps our skull together, and that's why you probably learned all the different parts of the skull, and those sutures are very immobile. We also have the gomphosis joint, which is basically what they call the peg and socket joint, which are teeth into our lower and upper jaw, which obviously we don't want to fall out too easily, so we want those to be immobile. Then we go on to the amphiarthroidal or the syndesmosis, which is two bones joined together by a really strong ligament, which we sometimes call the interosseous membrane. And the one you're seeing here on this image is between the tibia and the fibula, because we don't, those, in case the proximal part of our ankle joint, we don't want those bones to spread apart. So we want them to remain very stiff and immobile and together so our ankle joint works. Another one is a synchondrosis joint, and that is the cartilage that connects our sternum to our ribs, sometimes called the costal chondral cartilage. And if you've had the unfortunate experience of stretching out that cartilage, it is very, very painful. And then we have what we call the symphysis. And the one shown here is the pubic symphysis that connects our two os cocci bones to form the pelvic ring with our sacrum posterior. And there's very slight movement between those bones as well. Then we go to the diarthroidal joints, which are the most mobile, and those are the synovial joints. And we'll talk about individual synovial joints in the next video. But for now, let's just discuss synovial joints. They're freely movable. They're stabilized by ligaments, and those can be internal ligaments or external, or capsular ligaments. There's synovial fluid, which is secreted to lubricate the joint, so it moves with a low amount of friction. Then we also have hyaline cartilage that covers the articular surface, which can absorb shock, protect the bones, and also makes a frictionless surface, and it absorbs and secretes synovial fluid. These joints are covered with a sleeve-like capsule, which kind of contains the synovial fluid, so it's not released throughout the body. And then sometimes we have a specialized fibrocartilage discs, and the ones you guys are probably familiar with are the menisci in our knee. So given these joints are so mobile, how do we stabilize them? Well, there's a few ways. And as we're going through these, I want you to think about how all of these ways to stabilize our joints can also affect our quote unquote flexibility. So sometimes, if you're stretching to increase flexibility and trying to, and your range of motion is limited by, say, number 5, bony structure, that's kind of a futile effort. So I just want you to keep these things in mind when you're also thinking about flexibility. So the first is we stabilize joints by ligaments, say our collateral ligaments of our knee, the LCL and the MCL. We can stabilize joints by muscle tension. So say our hamstrings cross the knee joint, and when we engage our hamstring muscles, those can create a tension or a stability about the knee joint. Fascia and skin also create stability. Atmospheric pressure, say the glenohumeral joint, it has like a suction to keep it in place because it's a very odd joint, the way it's structured. And then we also have bony structure. So say for the elbow joint, the depth of your olecranon fossa can increase your range of motion or your stability, or the largeness of your olecranon process. So those are a few things to keep in mind.